Dear audience, in the next couple of minutes I'm going to present my research topic, which is extraintestinal manifestations in inflammatory bowel disease. My name is Ágnes Tímár. I'm a first-year PhD student and a pediatric resident at Heim Translational Pediatric Institute. My supervisor is Katalin Müller and my scientific methodology supervisor is Mark Hernátfői. I have a vision to improve the quality of life of IBD patients through proper treatment, and for that my mission is to assess long-term disease outcomes and treatment options for IBD patients with extraintestinal manifestations. I have two ongoing projects. Both of them are focusing on extraintestinal manifestations. In the first one, I'm investigating the frequency of extraintestinal manifestations during the use of different second-generation drugs, conducting a meta-analysis. And in the second one, I'm interested in the relationship between extraintestinal manifestations and the intestinal disease scores, performing a registry analysis. So let me introduce my meta-analysis topic and tell a couple of facts about its background. Extraintestinal manifestations are common in inflammatory bowel disease. Approximately 10–25% of the patients develop at least one by the time of the diagnosis. These patients face greater challenge in their daily living due to a greater symptom burden, higher pill burden, impaired quality of life, and because of all of these, they have a higher risk of permanent work disability. According to our current knowledge, anti-TNFs are effective against extraintestinal manifestations. However, 1/3 of the patients experience loss of response within 3 years. And in this situation, clinicians need to choose a new drug. We have several second-generation drug options available. I will highlight the most important ones. So first, we have ustekinumab and tofacitinib. They have a common trait that they both have a systematic effect and are already applied for other autoimmune diseases such as psoriasis or rheumatoid arthritis. Ustekinumab suppresses directly IL-12 and IL-23, which are pro-inflammatory cytokines, and tofacitinib inhibits all Janus kinases, and by that it blocks a transcriptional pathway which should produce other pro-inflammatory cytokines. On the contrary, we have vedolizumab, which belongs to the anti-integrins. It specifically targets the alpha-4 beta-7 unit, which is a physiological integrin in the gut, and by inhibiting that, it blocks the T cells from entering the gastrointestinal tract. So it is important to emphasize that it has only a gut-selective effect. These are our main options available, but we don't know exactly which of these is the best to prevent the development of extraintestinal manifestation. Therefore, it is our aim to determine which of these drugs is associated with the lowest frequency of new and recurring extraintestinal manifestations. So our clinical question is, what is the frequency of new and recurring extraintestinal manifestations during the use of different second-generation drugs? And we are investigating IBD patients who are on second-generation treatment, and our primary outcomes will be new and recurring extraintestinal manifestations, where the secondary outcomes are improvement and worsening of already pre-existing extraintestinal manifestations. We hypothesize that the frequency of extraintestinal manifestations is the highest in patients who are on gut-selective biologicals. And by answering this question, we plan to identify the best second-generation drug to avoid new and recurring extraintestinal manifestations. My systematic search was conducted on the 15th of November in 4 databases. And as you can see, my final search key contains 3 domains. The first one is about IBD, the second one about the different treatment options, and the third one about the extraintestinal manifestations. And out of the 13,000 hits, we found altogether 131 eligible texts after the full text selection. So let me introduce my second topic, which will be registry analysis about the association between extraintestinal manifestations and the intestinal disease scores. As I mentioned before, extraintestinal manifestations are really frequent. They are even more frequent in pediatric IBD. 25–40% of the patients develop at least one during their lifetime. However, little is known whether these patients experience a more severe intestinal disease course. And we found a recent meta-analysis which showed that these patients have a higher risk of undergoing IBD-related surgery and receiving biological therapy. The included articles in this meta-analysis were mostly about adults. Only 9 articles were about children. So we are interested whether the situation is the same in the pediatric population. And there are already some studies in the literature which suggest that early aggressive therapy could prevent long-term complications, such as surgery and relapses. Our aim is to provide data about the frequency of extraintestinal manifestations among Hungarian children based on the Hungarian Pediatric IBD Registry, and to analyze the association between the presence of extraintestinal manifestations and the intestinal disease scores. So our clinical question is whether there's an association between extraintestinal manifestations and the intestinal disease scores in pediatric IBD patients, and we will compare those who already present an extraintestinal manifestation at diagnosis and those children who develop the first one during the follow-up with those who have no extraintestinal manifestations at all. And our outcomes will be therapy failure, surgery rates, steroid dependence, and relapse rate. Our hypothesis is that patients with extraintestinal manifestation have a higher risk of poor prognosis of IBD. And we plan to define the role of extraintestinal manifestation as a prognostic factor so that these patients could benefit from earlier treatment escalation. And let me tell you some information about the registry we are working from. As I mentioned, it is the Hungarian Pediatric IBD Registry, which was launched in 2010. It is a prospective nationwide registry involving 27 centers and 45 pediatric gastroenterologists. And it provides not just clinical, but demographic and anthropometric data about the patients. So we will enroll all children who are diagnosed with IBD, Crohn's disease, and ulcerative colitis as well. And we would exclude those cases where the diagnosis changed during the follow-up, and those children who have an other active autoimmune disease. So this is the summary of my 2 projects. I plan to submit the first one in June and the second one in August. And let me finish my presentation with a quote that the best preparation for tomorrow is doing your best today. And thank you for your kind attention.
It's a very interesting plan. And I suggest you that maybe it's worth detecting extraintestinal manifestation or asking for that, whether it presented itself before the diagnosis of IBD. Do you plan this?
Yes, so maybe it's hard to tell from the registry because sometimes there's no information whether it was only detected at diagnosis or it was present before the diagnosis, but we plan to do it as well.
Oh, thank you for your presentation. I will have kind of a simple question, or I don't know, if you, on your second project, if you find that EIM is a poor prognostic factor, can you do something about it, or?
Yes, thank you for your question. So these patients need more strict and frequent screening, and the pediatric gastroenterologist or gastroenterologist should consider that maybe they need an earlier treatment escalation. I mean, giving them biological agents at an earlier stage.
Congratulations for the presentation, and I have a question, but it's a little bit compound. So what is considered extraintestinal manifestation, and is there a guideline for that, or can you tell me a few words about it?
Yes, it is an important question, so thank you. There's a definition from the European Crohn's and Colitis organization that extraintestinal manifestations are inflammatory pathologies which are located outside of the gastrointestinal tract, but they are associated with the same predisposing factors, and they have the same origin as IBD itself. And so they are listed, and for example, joint involvement or skin manifestations, etc. And there are extraintestinal complications, which are actually results or consequences of the chronic inflammation, such as anemia or metabolic bone disease.
Thank you for your great presentation. I'm just wondering, maybe I missed some information, but you mentioned that the first generation biologic drugs can lose the efficacy after 3 years, I think. And I'm thinking that in your first project, would you like to make a subgroup analysis for the patients who had first generation biological drugs before the vedolizumab and the tofacitinib or not?
Yes, thank you for your question. We plan to make subgroups based on that, so patients who are bio-naive and bio-experienced. So yes, we plan to do this if we have enough data.